Hi guys, my name is Nimesh Verma. Uh, Recently, I have cleared FMG August 2020 session. I've got 195 in that exam. Lots of you have guys asked about my strategy regarding the exam, what should do and what shouldn't do along the preparation. Uh, First of all, I would like to thank PrepLadder because it's such an amazing, to the point. Their tagline is "पढ़ो उतना चाहिए जितना." So that's the thing I like about them, because medicine is such a vast, so much to read in this curriculum. So in prep later they will give you what to read and what to focus on most. So and why I chose preparator, the other reason is being that faculty. You see the big names in the faculty: Dr. Prashant Vij, Dr. Vivek Jain, Dr. Apur Mehra, Dr. Govind Raigar, Dr. Sparsh Gupta, Dr. Deepak Marwa. These all are big names, so you know them, right? That's why, because of faculty, I chose the prep ladder. And after being the member of prep ladder, I've seen that these guys are really helpful. Even the student support, the prep ladder administration is also good. So they reply you instantly. They don't make you wait along. So that's your answer why I chose prep ladder. The Now I would like to share my tips regarding how I studied and what I did to get 195. So I have written the tips so I won't forget along the video. So my first tip is start from basics. Why start from basic, and what do I mean by start from basic is that if I ask you what is cell, you know what is cell, right? It's such a simple question. But if I ask you about the organelles and their function, somebody will remember and some won't. So you have to work on that basics. Why I say start from cells and then basic tissue. If I ask you how many basic tissue we have in our body, there are 4 basic tissues, namely connective tissue, epithelial tissue, muscle tissue, and nervous tissue. If you know the basic of this 4 tissue, the medicine is roaming around this 4 tissue only. You see every cancer, epithelial cancer, carcinoma, sarcoma, connective tissue cancer, right? These all are roaming around this 4 tissue. But I have seen so many people ignoring this, the basics of these tissues, how they work, how they are differentiating from each other. If they don't know the basics, you imagine how they will go along when the subjects like pathology will come, subject like ops and gynae come. There are so much integration is there nowadays. So that's my tip 1, that start from basics. So tip number 2 is for first year subject, take help from YouTube and internet. That's what I did in my first year. And I will tell for the December FMG guys, I know that you have only 3 months, but this tip is for the people who are in second year, third year. So when you are reading about first year and second year subject, at least first year subject, take a help from YouTube and internet. There are amazing platform which will give you quick information and very to the point information, like Osmosis, and those platforms really helpful. So that's it. Use the take advantage of internet in a good way. So that's the tip 2. Now tip number 3 is being always thorough with your medical terminology. What do I mean by medical terminology? See, myself being from Gujarati medium, I have always struggled in first year. So eventually that helped me also. If I don't understand anything, I will search in the Google what is the meaning of this, and I will write in my notes or in my in my book or whatever I'm reading. I will write the basic terminology, basic definition of that thing or that term. So that will help you to open up your mind regarding the subject. So that's what the basics means. You have to thorough with the terminology. Now tip number 5, that answering your question about regarding to read all 19 subject or not. So I will say yes, you have to study 19 subject. Personally I did 18 subject, but why I'm saying 19 subject to you guys, because the question pattern has changed nowadays. You see, if you go through the question of August, and you will understand why I'm saying to you have to study 19 subjects, because you will not they will not follow the exact pattern of mark distribution. So anything will come. You don't know what question or what subject will be dominating in the paper, right? So you have to study everything. And how you have to study. See, that's also tip number 5, that always whenever you are reading any subject or any topic, whatever you are reading, or seeing, watching a video, always keep one blank paper, A4 sheet paper, or anything, any notes, whatever. And then whenever you are watching videos, if the professor or if the faculty is saying something, the terminology, see, I'm again emphasizing on the terminology. You have to work on the medical terminology. That's how you will get the clinical orientation, right? So write the basic terminology, basic definition everywhere. I'm again and again emphasizing, because that's what made me achieve this good score. So that's it. And then tip number 6 is being something motivational, that always believe in yourself. There is no meaning, there is no meaning to putting so much effort in one thing, and that you don't have any desire to become best in that field, right? Everyone is trying to get 150, but I would say not target, just don't target for FMG, target for NEET PG, target for AIMS PG. That's what I did. I bought prep letter NEET PG package, not FMG, because I know that you have to trust your potential. Even if you have made mistakes, you have to if you see the guys who haven't studied very well in their academic years, they can buy prep letter FMG pack, they can work on their basics, and then they can come on the NEET PG package later on after clearing the FMG. But if you are in second and third year, you have to start from starting only, set your targets high. Okay. Next tip is regarding timetable, how to make it and how to follow the timetable. I used to, whenever I study any subject or whenever I'm doing anything, always paste this kind of timetable, this kind of, or whatever you like, but always keep timetable in front of your study table, or in front on your study wall. Why? Because it will motivate you, it will tell you regarding your preparation, it will tell you how you are going. I used to write my daily study hours here in the side corners every day. So whenever I feel low, or sometimes if I'm not studying well, or some days I'm feeling low, I used to calculate that the average of previous days, like 10 days, 15 days. So it will always come around 8 hours, 7.5 hours, something like that. So it used to give me motivation. Even if I wasted this day, it's okay, because my average is still being 7.5 hours to 8 hours. People out there is calling that you have to study 14 hours, 13 hours, 12 hours. I don't believe that. Whatever hours you are comfortable, but be constant regarding that. Always be constant regarding your study hours. See, if you are studying 6 hours, it's okay, but daily 6 hours should be there. I understand someday you won't be able to read at least 2 hours also, but it's okay. Someday you won't study anything at all, but next day you have to cover up. Okay. And always try to achieve your target 50 to 60%. That's okay. If you are achieving that, it's great, because you are moving ahead. You are not staying that on that place only. If you have set target to study 12 hours and you have given yourself a big target, and if you are not able to achieve it, you will just achieve 20%, and you will say okay, I'm not into this, I will not study. Okay, that won't gonna help. Set achievable targets. Okay. And then if you are able to achieve 50%, 60%, that's okay. That's the thing I did, and that's the thing motivated me, right? Calculate your calculate your weekly, or 15 days average every time you are feeling low. Okay, you will feel motivated after you see that, okay, even if I wasted this day, nothing will gonna happen, my average is still being 7.5 to 8 hours. That's my study hours. I used to study 8 hours only. Even the day before exam, I study only 8 hours. That's it, because I don't like to take pressure too much on myself. Now, final tip for December aspirant, December FMG 2020 aspirant. What you can do, I have divided the strategy in 3 steps. First step, finish your first reading from any source. If you are unable to finish your subject, you can go for prep letter, rapid revision. Everything is covered in rapid revision. Okay, just you have to thorough with your basics, and by basics I have already explained what do I mean by basics. Okay, and then after you finish your first reading, in first reading I used to give less importance to MCQ, only 15 to 20 minutes per day. But after my first reading, I turned my preparation towards the MCQ. And while attempting MCQ, I will attempt it actively. What do I mean by actively? See, there are 4 options. If they ask you about, in a previous year MCQ, they will say what is the stage T4B in breast cancer. So there will be direct one liner, right? There will be one option, there will be one answer, right? But I used to study other 3 options also. That what the other 3 options in the stage kg. Okay, so that's how you can go. And then if you are solving MCQ and you are seeing orphan ani nuclei, you are seeing samoma body, you are seeing these things, and you know that they are asking again and again about papillary thyroid carcinoma. Okay, so what you do, you have to give much importance to MCQ, and while attempting MCQ, keep your notes beside. Okay, so if you are feeling that okay, thyroid cancer is being repeated again and again, open your notes, study about papillary thyroid carcinoma or medullary carcinoma. Okay, and read everything about it, sign and symptom, diagnostic, treatment, everything about that. If you think that you will forget again, you just take a picture of it, or mark it with a different color or anything, whatever you like, so you know that this thing is being repeated in the previous year. Okay, and you are just not doing one liner, you are reading everything for that topic, right? So see, you are preparing for the third revision also. You will know that what you will study in the third revision. While doing MCQ, you have to study all 4 MCQ, not just one MCQ, not just one option. You have to study all 4 options. That's what I mean. Okay, and then also whenever you feel that this topic you are weak, open your notes and study and mark it with different pen. Okay, I used to take one picture for that topic. Okay, and then I have created the album for every subject. So in final revision, in 10 to 15 days, when you are left with only 10, surgery can't be finished in last 10 to 15 days. So what I used to study in 2 days or 1 days I have given to surgery, I used to study those 300 to 400 pictures I have taken from my notes, like varicocele, hydrocele, testicular torsion. This picture of my own notes. Okay, so I can, even when I'm not feeling sleepy and when you are on bed and you are stressed, you can just go through this picture and study those important topics regarding everything about that. Okay, diagnostic, treatment, sign and symptoms. This all you have to focus on. Just don't focus on one liner. Okay, I already explained. If you are even solving one liner MCQ, you can get so many things from that. Study all 4 options. That's my tip. Okay, so that's your second revision. You are in second revision, give importance to MCQ and prepare for the third revision. How? I already told you that mark it with a different color pen or take a picture. And in the third revision, whatever you have marked it, whatever you have take the pictures, whatever you have created album, just give importance to those subjects. But preferentially give much time to OBGYN and PSM. These 2 subjects you have to study thoroughly. Okay, and for other subject you have taken the pictures or mark it with a different color pen. That's only you have to study in your third revision. And rest all is there in your mind. It's just the feeling that we all get after first reading that okay, I forgot everything, what I will do. So there's nothing like that. 60% you retain in your first reading. Second reading, you are giving importance to MCQ. You are applying your knowledge. You are saying that okay, this topic is being repeated. You will study the diagnostic and everything. Okay, and you are also making for your third revision. You are marking everything, and in third revision, whatever you have marked, you will study that only. That's the tip. Okay, I would like to wish you all the best, everyone, and I would like to again thank you, PrepLadder, for giving me opportunity to share my strategy. Thank you very much, all the faculty, and thank you, PrepLadder. Thank you very much.